It's important to maintain your Jejunostomy-tube or Jtube as instructed by your MD Anderson Cancer Center care team. To do so, you will need unscented soap, tap water, towels, cotton swabs, 4 by 4 inch gauze pads, medical tape such as Medipore, a 1 milliliter slip-tip syringe, a 60 milliliter slip-tip syringe, and a 60 milliliter ENFit syringe. Lift the corner of the dressing away from the skin and then gently push the skin away from the dressing. Keep doing this until the dressing comes off. Clean the Jtube site with a wet, soapy cloth. Next, clean off the soap with a wet cloth and pat dry. You may do this while taking a shower. Using a cotton swab, clean underneath the Jtube disc. To apply a new dressing, fold a gauze pad in half and put it under the bottom part of the tube disc. Place another folded gauze pad over the upper portion of the disc. Place a third gauze pad over the tube and tape it down. Always keep the extender of the Jtube taped to the skin. This helps reduce tugging on the sutures and dislodging the tube. It is normal to have some drainage around the Jtube site. If there is drainage, it is important to change the dressing often to keep the skin dry, prevent skin irritation, and site infections. If you need to change the dressing several times, contact a member of your care team or your doctor. They can suggest other options to help protect the skin and limit the number of dressing changes. Manual flushing is very important to prevent clogging in the Jtube. You will do manual flushing in addition to automatic flushing. Flush the Jtube 2 times a day. After washing your hands, fill the 60 milliliter syringe with 60 milliliters of tap or bottled water. Make sure the syringe is free of air. Gently push the water into the Jtube to clear the feeding formula. If the tube becomes clogged, check to make sure the clamp is open and there are no kinks in the tubing. Remove the extension tube and try to flush water directly through the Jtube. Flush the extension tube separately with water. If it's still clogged, gently pull back the syringe plunger and try to remove any formula. If you are not successful, use a 1 milliliter syringe to flush as much warm water as you can into the Jtube. Cap the tube and wait 15 to 30 minutes. Afterward, gently pull back the syringe plunger and try to loosen any formula. Repeat this process several times or until nothing comes out. Flush the Jtube with 60 milliliters of water. If you are unable to unclog the Jtube, contact your care team. A home supply company will provide you with supplies to give yourself feedings. You will get a feeding pump, often called a Joey pump, and an instruction manual. The manual can help you troubleshoot if you have problems. To turn on the pump, press the power button located on the bottom right of the pump. Press Keep Settings or Clear Settings. Press the Keep Settings anytime the pump is turned off and turned back on to prevent having to reprogram the pump. The menu selection is on the left corner of the pump. Press Adjust Feed Rate, then press Feed Rate. Using the navigator buttons to the left, use the appropriate arrow to set your prescribed feed rate. Your dietitian will give you written instructions about the feed rate and flush rate. Press Enter at the top left corner of the pump. Press Done at the bottom left corner of the pump. To adjust the flush volume, press Flush Volume on the left side of the pump. Enter the prescribed flush volume. Press Enter at the top left corner of the pump. Press the Flush Interval button. Using the navigator buttons to the left, use the appropriate arrow to enter the prescribed hours for the flush. Press Enter at the top left corner. Press Done at the bottom left corner. Once the pump setup is complete, make sure that the written orders from your dietitian match the screen. Next, fill the feeding bag with formula as directed by your dietitian. Fill the water or flush bag with room temperature water. Remove any air from both bags. To set the pump for feeding, open the door on the top of the pump. Slide the thumb tab on the valve into the slot on the left side. Make sure it is pressed down and firmly secured in the loading column. Hold the black retention disc and gently wrap the tube under the rotor and drop the disc into the slot on the right. Close the door. Now you will prime the pump to remove air from the tubing. Press the Prime Pump button on the menu selection. Press Auto Prime. Remove the cap from the end of tube before priming the tube. If you still see extra air inside the tube, press the Hold to Prime Flush button. Press Done. Next, securely connect the prepared feeding bag to the Jtube. Press the Run button when you are ready to begin feeding. Formula in the feeding bag is good for only 12 hours. Cover or reseal and refrigerate unused or opened formula. Discard any formula in the feeding bag after 12 hours. If you are able, and it is okay with your doctor, take your medicines by mouth. Any medicine given through the Jtube must be liquid. Do not give crushed medicines through the tube. This will clog the tube and cause problems. Give each medicine one at a time. Do not mix medicines together. After giving all the medicines, flush the Jtube with 30 milliliters of water. You may fill the flush bag with water according to the instructions you receive. Water can remain in the bag for 24 hours. Clean and rinse the feeding bag with plain water until the bag is visibly clean. Do not use detergent or soap. Clean the bag every 12 hours before each feeding. Feeding bags are reusable. Bags can be used for up to 48 hours or longer, depending on the availability of your supplies. If you hear or see any alarms or error messages on the pump, follow the instructions on the pump screen. You may also use the instruction manual you received to help clear alarms. Keep these things in mind. A fully charged battery can run up to 12 hours. At night, double-check that the pump is plugged in to charge. While you are on tube feeding, make sure your head is always elevated at least 30 degrees. Do not lie flat. When you are in bed, use at least 2 pillows or use a wedge pillow to prop yourself up. When you are away from home, use the backpack provided by the supply company. When you are feeding at night or when you are inactive, such as sitting in a chair, use the pole provided by the supply company. Follow your discharge instructions. You may also call the Gastrointestinal Center at 713-792-2330 or contact a member of your care team. In case of an emergency, call 911 or go to your nearest hospital emergency center.